said, we're here to talk to you about our project on the South East Regional COVID-19 vaccination demand and capacity modelling. Bit of a mouthful. So working on the project was me, Charlene Black, and Adonis Sithole, Edward Chick, and Mayoor Dhokia. And our mentor was Matthew Dory, who's been great and very patient with us all. And today you'll be hearing from myself and Adonis. So Adonis and I both work for South Central and West CSU, which is an NHS organisation. So when we found out we're both from the HSMA, we decided to find a project to work on together. We talked through a lot of options and spoke to a few people about how we could help improve, enhance what they were working on. But the one that shone through for us was this demand and capacity model that the South East Vaccination Programme modelling lead had created. So the model was created in Excel, and it aimed to predict where demand would be and where there would or wouldn't be enough capacity. And as the model grew, it became quite cumbersome to update. There was a lot of laborious copying and pasting, manual updates, and obviously new cohorts were becoming eligible, and even increasing pace, and the speed and stability, ease of use and scalability of the model was in jeopardy. Therefore, we decided to see if we could create the model in Python to replicate what it does and produce similar outputs with less input needed from the user. The potential impact of this would be better information to target improvement areas of concern, significant savings in cost and staff time, as well as making adding new cohorts and demographics easier, which would help strengthen the vaccination programme. The first step we took in the project was to spend time getting to understand the current model, and we did this by talking to the modelling lead and other stakeholders. This was a vital step in getting to understand the intricacies of the model. From these conversations, we were able to determine a list of assumptions about the model that we would need to be aware of and possibly incorporate into our version of it. Some of which you can see on this slide. There was a lot more, so it's quite complicated. So after this, Ed then created this logic diagram of how all the different Excel tabs interacted and fed into each other to give us a better understanding of the task ahead. We then got feedback again from the modelling lead, which led to this second one, which is obviously slightly clearer, but still complex, and shows how many variables there were for us to think about. Once we had a better understanding of how the model worked, the next step was actually trying to get the data to input into the model. The vaccination data is stored in the NHS Foundry system, which is understandably very restricted. And this meant we encountered a few hurdles when it came to getting and using the data. The first hurdle was obviously ensuring that everyone had access to all the data that we needed. And when we finally sorted this out, we faced the issue of how to download the data, as there's so much data and there's limits on how much you can download in one go. So it meant it was a very slow process. And it was also restricted on how we could share the data once we downloaded it. So it meant everyone downloading the same data. So we could get started on actually modelling. We decided to just work with small amounts of data with the intention of adding more data to help test the model once it was up and running. So I'll now hand over to Adonis, who will take you through what we've done and learned from the modelling part of this project.
Thank you, Charlene. So demand and capacity modelling is driven by the ability to understand historic activity and being able to predict future trends. This is why we chose focusing techniques gained from Module 9 of HSMA 4 to help us explore the vaccination data currently in use. My colleague Ed Chick prepared the next few slides that I'll be presenting to you. He's currently on paternity leave. The last part of my presentation will introduce our proposed interactive Python demand and capacity forecasting tool, which is a dashboard that's interactive. So the time series in Figure 1 was created from weekly data held in the Excel demand and capacity modeling tool, covering first dose, second dose, and first booster vaccination uptake for the Southeast region. Figure 2 splits uptake by dose, and then Figure 3 shows that each integrated system in the Southeast of England exhibits similar uptake pattern. Since the existing weekly dataset did not exhibit seasonality and was therefore not suitable for producing a forecast, daily data shown in Figure 4 on the next slide was extracted directly from NHS Foundry for the HIWO system. So that's Hampshire, Isle of Wight system only. We couldn't take all the systems because there would be too many rows of code, as as Charlene has just outlined. However, figure 5 shows that seasonality is still not in evidence using the daily data. So the seasonal decomposition we have in figure 5 closely resembles the 7-day moving average in figure 4. Although it was unlikely to produce any useful insights, each technique covered in the lecture activities was implemented using the daily vaccination uptake data. Please see figure 6 showing the naive predictions, and next to it is figure 7, which presents the seasonal naive predictions. In figure 8, which is on the next slide, we add the upper and lower control limits, so the prediction intervals, so that's 80% and 90% prediction intervals. So at this stage, we then changed our focus from classic methods. Figures 9 to 11 on the next slide, they summarize the use of Facebook's Prophet library in forecasting vaccination events in the southeast of England. Since there's no real seasonality over the time period in question, Prophet has only been able to vaguely pick out the general trend, which can be seen in the downward curve of the blue forecast related plots in figure 9. Figure 10 shows us the general trend over the time period as identified by Prophet. So it's a decomposition of figure 9. In figure 11, if a holiday was added by Prophet, it corresponds to the date when there was a massive pre-Christmas 2021 drive for people to get a booster vaccination. So based on our explorations of the data, we concluded that there were not enough data points to see seasonality. If we move to the next slide, Charlene. So in the first few years, demand is all down to vaccination rollout, the vaccine rollout. Then in the future, we may see seasonality with annual booster uptake. So if we go to the next slide, please. I'll now summarize the key features of the Python dashboard that we are developing. This is the tool that we believe is going to replace the Excel spreadsheet. Its main purpose is to show historical and future predicted values as cumulative daily and weekly totals. It is dynamic, interactive, and designed to support the NHS team to explore different demand, capacity, and supply metrics. This forecasting dashboard has 4 major components, which are the headline figures on the left, a table of data in the middle, and we have line and bar graphs for each variable of interest in the upper right section. Maps of the chosen geography are shown in the lower right section, and then users can toggle between region and integrated care system. It will be accessed online, refreshes automatically when new data becomes available. It can be adapted to complement or replace struggling Excel spreadsheets through the use of free and open source tools, most of which were gained through taking part on the HSMA program. The libraries that we are using are spelled out on the next slide. So pandas, matplotlib, and scipy, we take them as the holy trinity of Python data science. Then plotly and dash are the ones which help us with interactive visualizations targeted for the web. Dash is for assembling our online dashboard. We've put all our code in Jupyter notebooks and the documentation as well that accompanies the tool that we're building. Facebook Prophet is another forecasting library that we have used, as you saw, from figures 9 to 11, and it's relevant for insights on vaccine forecast evaluations, trend analysis, and changes in seasonality. Over to you, Charlene.
Yeah, so despite not quite being able to reach our end goal yet, we've still found like HSMA very useful and an interesting experience. Before we started the program, most of us knew very little about operational research, data science, and machine learning and artificial intelligence. We now have a good understanding, and I myself have actually used some of this, some of the things we've learned in my work. And becoming more familiar with open source tools promoted by the HSMA program has been useful in helping to build some value-adding models that can be easily adapted to other scenarios within the NHS, obviously without the expense and restrictive licenses of commercial software. We've also been able to grow our professional network through interactions we've had on the programme and have gained a new confidence in engaging with clinicians, subject matter experts and other stakeholders to improve patient experience in the NHS. And we're all very glad to have been on the HSMA programme and are looking forward to see where the skills we have learned take us. So thank you all for your time, and we're very happy to take questions in the break or the chat.